Alright, this young man was just in a playground accident. He was actually playing handball and got struck with a knee. Yeah, as you can see, what happened was he got hit in the lip. His upper and lower teeth crashed. Tooth number 8, actually it wasn't number 9, tooth number 8 was displaced. I put that back into position at this point. It's a little bit mobile, so we're going to splint that. We'll do some patchwork on these fractured teeth. He's got 5 fractured anteriors that we'll just fix up for him. But we're just going to show you how easy it is to put the splint across from tooth number 7 to tooth number 9 to stabilize the situation. So here we have a piece of small GlasSpan rope. We're going to snip it as such, allowing the end to unfold, which will make it easier for us to place a flowable composite resin into the rope by injecting it with a needle tip syringe. And as you do that, you'll see that it'll continue to go to the end, and then finally it'll start to extrude from the sides, and you know you've got it completely injected. Now, you'll then coat the outside of the rope with a little bit more of the flowable. And now this piece is your splint, and we'll be ready to go and cut into to size. We're going to dry the teeth slightly. We're going to etch them with 37% phosphoric acid. And we'll leave that on for 15 to 20 seconds. Okay, we're going to take our clear adhesive, clear bond, place that right across those areas to receive the splint. Going to cure that, curing light. Good. Now we're going to measure the amount of the GlasSpan rope that we've pre-treated to see just how much we need, and we'll snip it. As such, put the flowable composite on the surfaces of the teeth to receive the splint. Place the GlasSpan material onto those areas. And cure. We're going to cover over the fiber material with the flowable composite. And complete the polymerization with the curing light. Now, last thing to do is just make sure that there are no sharp edges or rough spots. If there are, you can use a diamond stone to trim those down. Should you expose the fibers, that's not an issue. Just dry it. And we'll place a little bit more flowable composite over those areas to make sure that there are no exposed fibers. This is all being done without anesthesia at this point. This is a very comfortable procedure. And the very last thing we're going to do is just to make sure that the embrasure spaces are open. And here you have the completed trauma splint, which we will leave in place for approximately 4 weeks, which would be enough time for this tooth to stabilize. And then we'll just finally, how are teeth going now? They're much more comfortable?
Much more.
Good, okay, it's been about 4 weeks since we placed the splint, which we showed you earlier. And this is what it looks like. You want to take a little closer look at this. So we're going to use multi-fluted carbides to break off the actual splint, and then we'll polish these teeth again. And he should be pretty comfortable. I'm going to warn him to just look out for a few things. If he forms a bubble above these teeth, he has any excessive pain, which he's got no pain right now, or the teeth look like they're starting to discolor, he would notify us right away, because we might have issues concerning endodontic treatment that might be necessary as a result of the trauma. Very nicely, and we're just going to use these multi-fluid carbides to do the removal of the splint. Now we're going to go to the interproximals just with a scaler, make sure that we remove any of the residual composite, make sure it's smooth. Run some floss through here to make sure that we've got everything opened up and smooth. And then we'll do a little polishing of the tooth surfaces. And as we can see, these teeth are now quite stable. There's no mobility. He's comfortable. And I'm just going to give these a polish. And we've successfully dealt with this trauma situation using the GlasSpan Trauma technique and the GlasSpan Trauma Kit. All right, we'll give us a final rinse and take a good look at everything. There we go. We've got a nice result here. Minimal aggravation to the patient, and he's pretty much back in business.